them all day long, but don't really notice our feet until there's a problem. There are 26 bones, 33 joints, 107 ligaments, and 19 muscles in your foot. Injury, overuse, or inflammation can cause some of the most common foot pain. So here to talk about the most common foot ailments and what we can do about them, please welcome podiatrist Dr. Hartley Miltchin. Hi. Good to have you. Let's talk first of all about the three biggies, like the three big problems, foot problems people come to you for.
Absolutely. In my clinic, the three biggies are ingrown toenails, heel pain, and the real big one is bunions.
Bunions.
And I suppose it's the same in any podiatry office.
Yes. Okay, do you want to talk a little bit about each one, like ingrown nails to begin with?
Sure. Ingrown nails can be very painful. It happens in all ages. I see it in kids, in adults. And generally it's caused because the nail is too curved, and it's usually the big toenail.
Yeah.
It's too curved. It digs into the side of the skin.
Yeah.
It can become very painful, very swollen, very red, and very infected.
Okay.
But the answer isn't to take antibiotics if it gets infected, because that's not really what the problem is. So that nail that's digging into the skin needs to be removed. At my clinic, I do a very simple procedure where I take out just the edge of the nail, not the entire nail.
Yeah.
And that's a permanent procedure. It's a very easy procedure.
Okay, if your nails naturally grows that way, what should you be doing to try and prevent that from happening? Should you just be cutting off the end so it doesn't keep growing into your skin?
Well, a lot of people say, and you'll always read, to cut your nails straight across, but nails are like hair. Everybody's are different.
Yeah.
So if the ends are digging in because you have a very curved nail, I have no problem with cutting out a little edge of the borders at the end of the nails.
Yeah.
To give you relief.
Okay, that makes sense. Cut it like this on the two sides.
Round it.
Round it,
Yes.
right? Okay, how about heel pain? What is happening that people are getting this heel pain, do you think?
Heel pain occurs in both men and women.
Yeah.
It doesn't matter your body size or your activity level, but it's a very painful, frustrating problem. And it's often referred to as heel pain syndrome.
Okay.
And when it hurts after rest. So first thing in the morning is brutal. First 20 steps. A lot of people tell me it's like somebody's poking a hot knife up into my heel.
Ouch.
And then it relieves itself until you've rested for a while or driven for a while, stand down, and you have extremely bad pain. And some people have to give up their activities because of this particular problem. We use a lot of laser technology in our clinic to help cure this problem.
Right. Do you know what might be causing that? Like, why would you start getting that?
It's a mechanical imbalance that we're born with, the way we stand and the way we walk, and there's a very strong band on the bottom of the foot that holds the foot up.
Yeah.
And if we overdo something or do something out of the ordinary, we can get a tear where it anchors to the heel bone.
Yeah.
And that starts off an inflammatory response, some swelling, and that's what really hurts. It's not the heel spur that hurts.
Okay. All right, let's get into the bunions.
That's
Super
a biggie.
popular, these bunions. They're everywhere, they're prevalent. You have a lot of people coming to you with bunions. First, explain what a bunion is. Well, there it is. You see the picture. We all know what one looks like. That causes a lot of pain, right?
It causes a great deal of pain, but I also find generally with women that they don't like the cosmetics of it.
They just don't like the way it looks.
Look of it.
Okay.
But what that is, a lot of people believe that it's just a bump that grows on the side of the foot, but it's not. It's more complex than that.
Okay.
And it goes back again to the mechanics of the foot, how we are born to walk and stand. We put too much weight, force, and stress on the big toe joint, and what happens is the bones start to drift out of alignment. Not overnight, it takes years. And it becomes extremely painful. There's a myth that high heels cause it.
Don't look at my shoes.
I
Hartley.
did already.
What do you think of these?
Job security. I'll always have a job.
Yeah. Okay, all right. I'll be seeing you in what, 20 years, 15? How long you give me? Okay, so you put a lot of pressure on that big toe, and it, you get that bone coming out. In the past, if you wanted to get your bunions removed, we're talking major recovery time, right?
It's major.
Yeah.
What I call the traditional bunion surgery or the hospital surgery. Number one, it's done in the hospital. No one wants to go to the hospital for their feet.
Yeah.
General anesthesia, which is very risky. Long incisions, narcotics or opioids to control the pain, many weeks or months off work, sometimes a year until you can wear your normal shoes, as opposed to the procedure that I've been doing for almost 40 years,
Okay.
which I just use numbing, much like a dentist would.
Yeah.
I do it in my clinic.
Yeah.
I don't make incisions. I just make 2 or 3 small pokes that don't even require stitches.
Okay.
I don't put any metals in like screws, wires, pins, staples, rods.
Thank goodness.
No casts and crutches, none of those big plastic, what I call the moon boots to walk around in. You can return to work in 48 hours. You can drive in 48 hours. You can go do certain activities at the gym in 48 hours.
Yeah.
And for pain, no narcotics, no opioids. I tell people if you have pain, over the counter what you typically take for a headache.
Okay. All right, so bunion surgery, I mean, the takeaway is it's come a long way. Make sure you get into it and check your options, and we've got your information now, so go look this guy up. Apparently, me and him have a date in a few years.